Hi class, it's Sarah Bergen. I am here to talk about the use of data sets and informational management. I am the assistant nurse manager in the operating room at Highland Hospital in Rochester, New York, and I am excited to talk to you about this topic today. So let's start with what exactly are data sets and information management? A data set is a collection of related sets of information collected from separate items, which can be manipulated as a unit by a computer. These items can be few to many and placed all together, creating a data set. Just to name a few, the items included are medical data, various measurements, financial data, statistical data, demographics of specific populations, insurance data, and they're all gathered from various healthcare data sources. So why do we collect this data? We collect this data for potential for improving healthcare through bringing together multiple sources of data. Data collection by the use of electronic health records help administrative and claims healthcare data in order to allow the reimbursements for the healthcare services that have been provided. So what is healthcare information management? People in healthcare information management, also known as HIM, are tasked with collecting, analyzing, storing, protecting, and ensuring the quality of patient health information. A few examples of jobs that are under the HIM umbrella include electronic record management, billing, coding, auditing, and compliance officers. I know at Highland Hospital, where I work, the safety officer is somebody who would be under the HIM umbrella. So let's talk about data standardization. It's the critical process of bringing data into a common design that allows for collaborative research, sharing refined tools and methodologies, and large-scale analytics. It is the key to support for efficient and meaningful use of the collaboration and information of healthcare professionals, government agencies, care providers, and insurers. One of the models that I thought was interesting was the OMOP Common Data Model. This model allows for the systematic analysis of observational databases. The concept behind this approach is to transform data contained within those databases into common format. This is considered the data model, as well as common representation. Then perform systematic analysis using a library of standard analytic routines that have been written based on common format. So what is data mining? And this is within data sets. Data mining refers to the technique of data exploration that searches for trends and patterns within the data. The reason data mining is so beneficial to organizations is the way it identifies the most useful data sources and gives insights into how to use them most effectively, reducing costs and increasing quality of care and best practice. Next, I would like to talk about sources of data. So, sources of data, there are so many. There are so many sources of data sets that help improve the delivery of healthcare. These are just a few that have a high impact and importance of system approach to data collection and meaningful use for future data-driven healthcare. Some examples of data sets include the Uniform Hospital Discharge Dataset, the Uniform Ambulatory Care Dataset, Minimum Dataset for Long-Term Care, Data Elements for Emergency Department Systems, Outcomes and Assessment Information Set, Health Plan Employer Data and Information Sets. And again, these are just to name a few. To name a few data sets for healthcare analytics include healthdata.gov, the World Health Organization, the Human Mortality Database, data and tools of the National Center for Health Statistics, OpenFDA, the Big Cities Health Inventory Data Platform, Medicare.gov, and National Cancer Institute. So what do we do when we collect all this data and we have so much of it? So what is big data? The first time the term was used in 1997, and the term refers to the vast and growing volumes of the computer-generated healthcare information available, and these are in the forms of our electronic health records, administrative or health claims data, disease and drug monitoring registries. Big data is also referred under the 4 V's. These are volume, velocity, variety, and veracity. The 4 V's refer to the large quantity of data that is rapidly updated and requires continuous checking. So what are the components of big data? This chart shows all of the different ways that data is recorded and collected. Ranges from healthcare service payments to primary care, clinical databases, emergency visits, drug prescriptions, mortality and disease registries, and again, these are just to name a few. And all of this information is recorded and then passed into a big database, which then can be sorted into storage, data analysis, visualization, and reporting. So the benefits of big data. The benefits include IT infrastructure, operational benefits, organizational benefits, managerial benefits, and strategic benefits. Other benefits of big data show reduction in system redundancy, avoiding unnecessary IT costs, and transfer of data throughout the healthcare system. So how do we collect all of this big data? As I showed you before and in that model, with all the different recordings, it's usually routinely during administrative processes and clinical practices. For example, these include physicians recording patients' medical visits and history, medical claims, drug prescriptions, and again, everything else that we saw in that previous model. So why are data sets and information management so important? In conclusion, by involving IT professionals experienced in managing and leveraging healthcare data, by the use of databases and informational management, healthcare organizations are able to deliver solutions necessary to make informed decisions and improve the quality of care for their patients. And this is just a list of references where I found a lot of useful information. I found some great articles, the Big Data in Healthcare, some great websites that talked about data standardization. This was the Observational Health Data Science and Informatics website. And some other articles that referred to big data and big data analytics. And the one that Dr. T provided for us on the 10 best healthcare data sets was very informational with the list of data sets provided. So this is my presentation on the use of data sets and information management. I hope you enjoyed it. I know for me, on a personal note, technology sometimes can be frustrating to figure out, but by using the 10-second rules of Dr. T, you find that technology can be extremely useful, data can be useful, and without the data sets that we have currently at Highland Hospital, I know that my job would not be as easy as it is today with finding the information needed to provide the best care we possibly can for our patients.